Hi, I'm Rhona Cameron. I'm an aesthetic doctor at McKeown Medical. Today, I'm going to use the signature McKeown Method to help restore Isabel's ageing face. Isabel's 55 and this is my first time treating her. If we just stand back and take a look, I think it's clear that Isabel's an attractive lady who looks really well for her age. And I think it's important to just start with that little bit of context before we delve into critiquing her appearance and thinking about how we can improve things for her. Isabel has had some filler injections before, about 18 months ago in another clinic. She had some in her cheeks and lips and she thinks that's gone, although I think there might be some of that still present. When I look at Isabel's face objectively, there are a couple of things that stand out to me that could be improved. The first thing is that she's the classic signs of volume loss that we'd expect in someone of her age, resulting in the deeper lines around her mouth and chin. She also has some sun damage to her skin that we could perhaps improve with some laser treatments down the line. But for today, we're going to focus on the volume loss. So let's look at the volume loss in a little more detail so that we can understand what's happened and work out what we need to do. If I start by asking Isabel to smile, we can see that she's already quite full in the middle part of the cheek here. So I want to avoid adding volume here, because if I do that, when she smiles after treatment, her face will look too full. If we look at the back of the cheek, however, the volume starts to drop off, especially in the lateral cheek fat, so that's going to be the first area that we restore volume to. If we then come down to the lower face and look at the jaw angle, you can see that the angle of the jaw has started to move up, which happens as the bone is reabsorbed from the mandible with age. So we want to add some volume back here to restore the vertical dimension of the jaw. If we then have a look further forward, you can also see that the chin has started to shorten, and so I want to restore some vertical dimension to the chin too. When we've done that, that's going to emphasise the already existing disconnect between the chin and jawline. So we'll work along the sides of the chin and then finally soften the lines and wrinkles around the mouth. So I'm starting off with the lateral cheek. I'm just making a little hole in the skin with a needle that allows me to insert my cannula under the skin. The cannula is a brilliant tool and it allows me to manoeuvre quite extensively under the skin, usually without causing pain or bruising. It's ideal for augmenting the tissues, although less accurate than a needle in some areas, so I like to flip between the needle and cannula depending on what I'm doing. I'm just gradually building out the lateral part of the cheek and getting the patient to sit up periodically so I can see how we're getting on and reassessing if I need to change anything. Constantly adapting the plan according to what I see at the time is key to getting the best outcome. The two sides of the face are never exactly the same, but we want them to be close. So moving down to the angle of the jaw, and this is an area where we need to be really careful in the female face. The last thing that we want to do is bulk out the jaw and make the face look more masculine, so I need to be careful to get the volume under the angle of the jaw in the areas that have lost volume without making the face look square. At the chin, I need more projection, so I'm going to use a sharp needle here and put the filler down on top of the bone. That sounds like it's going to be sore, but most patients find it surprisingly painless. By restoring the projection of the chin, it does a couple of things. It first helps to improve the overall facial proportions, but it also helps stretch the chin and improves the angle between the face and the neck. Now that I've done that, you can see, however, that it emphasises the disconnect between the chin and the jawline. So I'm going to address that next by restoring volume along the sides of the chin. This is going to really help reduce the appearance of the jowls. Finally, I'm going to use my favourite cannula again to reduce the deep lines from the nose to the mouth. We never like removing these folds completely. In patients who have a full medial cheek, if you remove the nasolabial fold completely, you make the mid-face look too full and unnatural. And that's us. Time for Isabel to have a look and give us her verdict.
My treatment's brilliant, all of the work done, absolutely brilliant. I hate that droop and that's so good. Thanks so much.
By following the principles of the McKeown Method, what we're doing is restoring the natural facial contours that have been lost through ageing and volume loss. The important part of the method is making sure that we don't change the face, but simply restore it, taking account of each patient's individuality. What we want to achieve is a look that's youthful and rested, but completely natural.